Bore da pawb, croeso cynnes iawn I chi, I gyd. Good morning everybody and a warm welcome to you all. My name is Jan Janczewski. I'm the chair of Cardiff and Vale University Health Board, and I'd like to welcome you all to the annual general meeting this morning. As chairman, it's a great privilege to introduce the annual report and accounts for 2019 and 20, together with the annual quality statement. This year is the first time we've held this event virtually, and we really appreciate your time in joining us this morning. It's a little impractical, I'm afraid, to introduce all of my board colleagues through a virtual platform, but the details are available to you with pictures in our annual report. However, I would like to introduce three of my fellow board members who will be presenting today, and they are Len Richards, our Chief Executive. Morning, Len.
Yeah, morning, Jan. Morning.
Ruth Walker, our Executive Nurse Director. Good morning, Ruth.
Good morning.
And Chris Lewis, our Director of Finance. Morning, Chris.
Morning, Chair.
Thank you. Traditionally, the annual general meeting will cover a 12-month period, but on this occasion, I hope you don't mind, I'd like to reflect a little bit on the last 6 months as well, where the Health Board has been severely impacted by the coronavirus pandemic. And during the last 6 months, I think we've seen the NHS has faced its biggest challenge in its 72-year history. COVID-19 has affected everybody in their daily lives across the globe and locally. It's affected how we work and live day to day. Unfortunately, it has meant that the UHB, or Health Board, has had to pause certain services to care for those affected by the virus. We've had to run our services differently and liaise with our patients and their families in different ways. The response from the population we serve has been very positive and supportive, and I'd like to thank them all on behalf of the board. I'd like to commend those organisations that we work with and rely upon to provide the services we deliver throughout Cardiff and the Vale, notably our local authorities in Cardiff and the Vale of Glamorgan and the third sector. I would also recognise in particular the many volunteers who work across the Health Board and to thank them for their dedication, their commitment and their wholehearted support. I believe it's really important today to pay a tribute to our staff and to reflect on the outstanding commitment of our staff who have worked tirelessly and compassionately to care for people and keep people well during these extraordinary circumstances. We have a great workforce who, despite the challenges and exhausting workloads, have been instrumental in providing superb care for our population. And as a board, we want to thank each and every one of them. It is particularly pleasing for me to witness the huge amount of support we've had from our communities and our local businesses. It was incredible to be part of the Clap for Carers campaign, which lasted 10 weeks and I'm sure helped to lift the spirits of our staff, carers and key workers across Cardiff and the Vale at such a difficult time. While we are reflecting, I would like to take a moment to remember those members of staff who have tragically lost their lives to COVID-19. Our thoughts remain with the families, friends and colleagues of Jitu, Gareth, Julianne, Alan and Dominga. Unfortunately, we're not yet in a position to go back to normal business and a second wave of COVID-19 seems to be upon us. We've learned a lot from the last 6 months and now have a better understanding of this virus. Whilst we are becoming more adept at treating it, the virus is nonetheless still with us, and we need to be constantly alert to its dangers and that it continues to present. It's the personal responsibility of us all to reduce the spread as far as we can by maintaining a 2-metre social distancing measure wherever possible, washing our hands regularly, only meeting members of another household outdoors and while social distancing is being maintained. Try not to socialise indoors with members of other households, including in pubs, cafes and restaurants. Work from home if we can. Wear a face covering when indoors and in public spaces. Stay at home if you or anyone in your extended household has symptoms. If you have symptoms, please get a test. The responsibility lies with each and every one of us to keep Wales safe. Despite the challenges of the last 6 months, the Health Board has made some good progress during the year overall, and we will show a video towards the end of the meeting to illustrate some of these achievements. Thank you for listening to my welcome. The next item on the agenda is apologies for absence. And I'd like to ask Nikki Foreman, our Director of Corporate Governance, to share with us any apologies. Nikki.
Okay, thank you, Chair. So we've had Stephen Allen from CHC, Gary Baxter, Abigail Harris, Rhian Thomas, Stuart Walker, Susan Elsmore, and Stephen Curry.
Thank you very much, Nikki.
Thank you.
The next item on the agenda is the minutes of the annual general meeting held on the 25th of July 2019. Can I have confirmation from the meeting, please, that they represent a true and accurate record of that meeting? I'll take no comment as a yes. Thank you very much. One of the difficulties of working on a virtual platform, I guess, is it's not quite as intimate. The next item on the meeting, on the agenda today rather, is the annual report for 2019-20. And I'd like to introduce Len Richards now to present that report as our Chief Executive Officer. Len.
Thank you, Chair, and thanks again to everyone for joining us virtually this morning at our annual general meeting. It's my role here to talk about the annual report, which reflects on our performance over the last year. But before I do that, can I echo some of the points that the Chair has made in his opening remarks? I'm incredibly proud of our staff and the way that they've faced into the coronavirus. Staff in the community, in GP practices, community teams, and in the hospital gave everything to their patients in what can only be described as an exceptional demonstration of commitment and compassion. So I would like to add my thanks to that of Jan, the board and the executive team for the work that they've done over the last 18 months. In my mind, this AGM is a celebration of all the great work that we've done, and it's also an opportunity to say thank you. So please take that as a measure of the support and the acknowledgement of the work that's being carried out. As a health board, we've achieved a lot over the past 18 months to improve services for our patients. And I just want to mention some of the key achievements we've had as a health board, which is a testament to the staff, both in hospital and community settings. So first of all, we launched the first Welsh gender service for Wales, meaning that the trans community could receive care closer to home when previously they would have had to travel to London or other UK sites. The children and adolescent mental health services was also repatriated to us here within Cardiff and Vale from the Cwmtaf University Health Board over the course of last year, and the employee wellbeing service for children and young people was developed further to improve mental health services for this group. We improved patient access to musculoskeletal and mental health services in the community by making these services available through GP practices. Over 2,800 patients had appointments booked with a first contact physiotherapist, for further developing the multidisciplinary team in the community and building greater resilience, as well as reducing waiting times for these patients. We improved care for dementia patients in the community through the implementation of specialist mental health practitioners who work in partnership with community resource teams and dementia liaison staff in GP practices. We also successfully introduced health pathways onto our system, joining up our community and hospital services. So currently we have 60 pathways that have been discussed between primary care and hospital care practitioners, and they're live. And one of the things that we're proud about is we introduced the first sepsis pathway, which was the first to be introduced across the UK. We increased the number of patients who receive dialysis in the community through the nighttime dialysis programme. And we successfully moved ENT elective surgery from University Hospital Wales to Llandoch Hospital, ensuring patients receive their care more reliably and in a timely manner. Moving on to COVID, we built the second largest Nightingale hospital in the UK with the opening of the Dragon Heart Hospital based at the Principality Stadium. And this was a very unique project, and we were very proud of the way in which we established it in a very short space of time. And we actually had to use that facility to respond to the demands of COVID, and we felt that we used that very well, and it was a unique experience for a number of our patients. Over COVID, we're very proud that we continued cancer surgery due to the partnership that we established with the Spire Independent Hospital to enable patients to continue with essential treatments. Spire also carried out ophthalmology surgery for patients who required essential eye care treatment, so enabling us to continue with those services through the demands. We developed the use of the Da Vinci robot to treat kidney and head and neck cancers, as well as prostate cancers, resulting in better outcomes and quicker recovery times for patients. We've also, over the course of last year, exploited the technology advances in genetics, and we're the first in the UK to implement whole genomic sequencing for undiagnosed sick infants with rare diseases, significantly reducing the time to diagnosis and therefore the time to treatment. And we also introduced a new and exciting cell and gene therapy treatment through our Advanced Medicines and Therapeutic Products program, offering patients life-saving therapies. So I'm coming to the conclusion of my bit now, and I could have gone on more. There are many more development improvements that I could talk about, and I feel I cannot do the organisation justice in the time I have available. But I do cover these developments weekly in my Chief Exec Connects, and members of the public can access that weekly bulletin if they follow me on Twitter at @cav_Len Richards. So thank you, Jan, for giving me the opportunity to speak. And once again, I'd just like to say thank you to the staff within our great organisation who go above and beyond on a regular basis in support and commitment to the patients that they see. Thank you.
Thank you, Len, very much. And reinforcing the message about our appreciation of our staff is very important. Thank you. I'm now going to ask Chris Lewis, our Director of Finance, to present the financial accounts for 2019 and 20. Chris?
Thank you, Chair. I will just upload onto the screen a short presentation. Has it been uploaded, or is it still?
It's there, Chris.
Okay, thank you. What I'd like to cover, mainly the accounts for 1920, but there's three areas. A review of our income and expenditure, our performance against our financial targets for 2019-20, and a financial outlook for 2020-21. With regard to the income we received in 2019-20, we received some £1.482 billion. You'll see that the vast majority of that came from the Welsh Government allocations direct to the Health Board, some £1.031 billion. But as a University Health Board, we also get a large amount of income for training, research and education, mainly for undergraduate and postgraduate medical training. You'll see we also received £240 million from WISC, and that was to provide regional and specialist services for the population of South Wales. And the last thing to highlight on this slide is that we also receive income primarily from our neighbouring health boards, which are Aneurin Bevan and Cwm Taf Morgannwg, some £74 million for the treatment of their residents within the facilities of Cardiff and Vale. This is how we applied our income in 2019-20. Again, we spent £1.482 billion. That's the equivalent of £4 million each and every single day. We spent, in the first three parts there, you'll see that we spent 44% of our income on our staff. That's £654 million. And the other bits I would just like to highlight to provide further information on is, as an integrated health board, we also spend a significant amount on primary healthcare services, some £238 million. The two largest components being £148 million on contractor services. These are services such as GPs and dentists, and £75 million on primary care prescribing. The other item just to note is that we also commission services for the residents of Cardiff and Vale, and we spend £128 million back with WISC and £55 million with other NHS health bodies. Just a very, very quick overview of the staff which we employed in 2019-20. We had average employees of 13,123 whole-time equivalents, the largest of which you'll see there are registered nurses and midwives, which made us some 30% of our workforce. And just to point out that medical and dental staff made up another 11%. Moving on to financial targets. The Welsh Government amended the financial duties of LHBs in 2014-15. I've set out there what the actual language is, but in simple terms, the first part is to break even over a 3-year period. And the second part is to have an approved integrated medium-term plan. For 2019-20, the LHB managed to generate a surplus of £58,000 against its revenue resource limit. And whilst it broke even within the year, it did form part of an accumulated deficit over the 3-year period of £36.3 million. And hence the UHB did not achieve its statutory duty under the first part of the Act. This is, however, a significant improvement given that the Health Board had a deficit of £26.5 million in 17-18 and £9.9 million in 2018-19. The UHB did, however, manage to have its integrated medium-term plan approved by Welsh Government. And again, this is a major step forward for the Health Board, as the last time it had an approved plan was way back in 2015-16. Similarly, the Health Board has a 3-year break-even duty on capital expenditure. In 2019-20, the Health Board spent £89,000 below its capital resource limit of £58.159 million. It therefore broke even on capital in year. And then over the 3-year period from 2017-18 to 2019-20, there was an accumulated surplus on capital of £251,000. Thus, the UHB achieved its duty against its capital target. Just a couple of highlights on our capital expenditure, really. I've just drawn out some of the main areas of spend. You'll see that we spent £18.5 million on a new facility to replace Rookwood Hospital. This is now due to open in May 2021, and the total spend on that new facility will be some £31 million. Other items to note, we spent £5.1 million upgrading the neonatal facilities at UHW. We spent £3 million on the major trauma centre, and this will provide much enhanced services for trauma across the residents of South Wales. And then the final point to note is we spent £1.8 million on COVID-19 related investment in order to try to manage the pandemic. With regards to our financial outlook, the UHB has prepared and submitted its integrated medium-term plan over the 3-year period, which shows financial balance in each and every year. But due to the impact of COVID-19, Welsh Government have paused the planning process, and whilst the UHB had an approvable plan, this has now been stepped down for the UHB to manage the impact of COVID-19. The management of COVID-19 has come with significant cost. At month 5, the forecast for the rest of the year is net COVID expenditure of some £149 million, for which the UHB has already secured £55 million additional funding from Welsh Government. Welsh Government has, however, received £1.3 billion in order to manage the response to the pandemic, and further allocations are expected, which hopefully will recover the remaining costs of the Health Board. With regard to capital, the UHB now has a confirmed capital resource limit of £80.634 million for 2021. There is a £14.548 million discretionary allocation, £17.908 million All Wales capital projects. We've managed to receive £14.948 million additional capital funding to help manage the impact of COVID-19. And we very, very recently have confirmation of £33.230 million for additional surge capacity at UHW. Management of COVID is putting pressure on our capital programme, and we've had to reprioritise some of our schemes while we're trying to secure additional resources from Welsh Government in response to the COVID-19. This concludes the financial outlook and was what proved to be a very uncertain and challenging financial year. This closes the review of financial performance and the accounts.
Thank you very much, Chris. I think it's important that we understand the significance of the amount of money we need to manage as a health board in the interest of our public, and in particular in respect of the health and well-being of the population we serve. So thank you for that presentation, Chris. It's appropriate at this point, I think we've had time to look at the detail contained in the annual accounts and the annual report. Is the meeting happy to adopt the annual report and accounts, please?
Yes.
Yeah. Thank you very much. Okay. Moving on then, the next item is our annual quality statement, and I would like to invite Ruth Walker, our Executive Nurse Director, to present to us. Ruth.
Thank you, Jan. Like my colleague, I'm going to share with you a presentation. Hopefully you will see that shortly. Can you see the presentation?
Not yet, Ruth.
Okay. How about now?
It's there now, Ruth.
Lovely, thank you. The annual quality statement, a really important document along with the other two that we've discussed this morning. And the purpose of the document is to share with you the work that we've undertaken to keep our patients safe, provide them with quality care, but also ensure that we're listening to the voice of our patients and their experiences whilst receiving that care in all settings within the health board. The AQS is a very detailed document. It's not my intention to talk you through all of that, but I'm just going to pull out a number of highlights within the report. The first is around incident reporting. So you will see there's been 17,318 incidents reported within the health board. You might think, gosh, that's rather a lot, and that's a little worrying. But for us who work in healthcare, we know that that's a really important measure for us. It's important to have large numbers here because people feel comfortable to report. So we have a culture where people are able to say there have been some near misses or minor areas of concern. And you will see of that 17,000, 15,758 of them have been minor or no harm has come to the patient, but where we identify areas where we could improve practice or improve the quality of care that we provide. Sadly, 226 of those were very serious incidents which were reported to Welsh Government. And those who regularly listen in to our board meetings will know that we report those into our open board meeting, and we investigate those in partnership with families to understand where we can do things better, or change practice, or try to prevent that from happening again. What a common theme that we have seen within our incident reporting, and you can see here is the 43 patients who've come to harm, who have fallen whilst in our care. We have had a considerable amount of improvement work being undertaken this year in trying to improve that situation, and we have seen good progress in improving the numbers of patients falling whilst in our care, and we'll continue to do that over the coming years. You will also see at the top right-hand corner there something called a never event. Well, a never event is called a never event because it's something that you never expect to happen. Sadly, in healthcare, because of the dangers of the service that we provide across the whole of the world in relation to healthcare delivery, you will on occasion see that never events occur. I'm delighted to tell you that we have seen a significant reduction in those this year. They've gone from 7 to 3. And it's very clear that within those incidents, we've seen progress and improvement, having learned from the never events of the previous year. Len referenced sepsis earlier, and I think it's important, and the sepsis pathway and the progress we've had there. It's good to see that 74% of our patients are now following that sepsis pathway, and we've seen improvements. In relation to patient safety solutions, we've also seen a 95% compliance. So on to the patient experience now. How do we gather that? Well, we have very different approaches to how we gather the patient experience, and most of the results you have here are those that we were able to capture prior to the COVID period. Although we didn't forget the importance of the patient's voice during COVID, and I'll talk a little bit more about that when I come to the end of this presentation. However, we did manage to receive 3,165 complaints this year. Again, it's really important if we're going to learn and improve our services that we listen to our patients and their families when we get things wrong. I'm delighted to tell you that we were able to respond to those complaints very quickly with an 82% compliance in relation to the 30-day target, where we involve families and answer the concerns that they've raised. Our current patient experience is measured through a patient satisfaction survey as one of the tools that we use, and the patient experience is currently rated at 97% at UHL and 93% at UHW. We're currently looking at how we might measure that for those individuals who are receiving services within our community. But you will see a big smiley face at the top right-hand corner of our screen. And that is where we have used the happy or not machines. And we've been able to distribute them across all of our community settings. That includes primary care, our clinics, and our patients are feeding back to us live what it's been like utilising those services. And currently that's sitting at 72%. What's very interesting in that piece of work is that we're able to correlate that with the times of day. So we know that people are not so happy if the clinic is running a little late at lunchtime, or they want to get away, and the importance of time for our patients and how critical that is for them. And that aligns with our strategic work we're doing within the health board. So again, we knit in what our patients are telling us into the strategic direction of the health board so that we can ensure that we're consistently complying with our strategic direction. You'll see that we've recorded only 159 compliments corporately. And that's predominantly because our staff across the health board tend to keep those lovely cards that you send them within their clinical environment so they can look at them from time to time, and quite rightly so. We encourage them to share them with us more corporately, but they're the numbers we get through corporately. Those on the ward you will see when you visit, there's much greater numbers than that. So every year we undertake an annual review of the health and care standards, and this year we reviewed 71 clinical environments. Now, it's really important to understand that when we look at our complaints, they're often about communication or direct clinical care, and you will hear quite nationally and internationally where people get concerned that their loved ones have not necessarily been fed and watered whilst they've been in hospital, or that some of the basics in relation to clinical care are not being met. I'm pleased to tell you that 98% of our patients felt that they had enough to drink whilst they were in, 94% of our patients had nutritional assessments, and 96% of our patients were given help to eat or drink whilst they were in our hospital environments. We knew last year that we needed to do more work around dementia training for our staff. We now know that 74% of our staff have received dementia training, despite the fact that we've been dealing with a COVID crisis. And 79% of our staff have had equality and diversity training within the health board. Again, a very important agenda to us as we care for a diverse community that we serve. So this has been a further variety of those scores that I was just alluding to and referencing in relation to nutrition, hydration, and so forth. It would be foolish of me not to share with you some of the challenges that we have faced this year and make you believe that we've only done all the things correctly that we want to. And you will see my previous slide, I did talk about mortality and morbidity. Again, we're seeing considerable improvement within that area. But what we did have was a HIW review, an inspection of our A&E and assessment area last year, of which the results were poor. And HIW and our inspectors, which included the Community Health Council, who had also identified this as an area of concern, was not at the standard that they would expect, our patients would expect, or that we as a health board would wish to provide. We undertook a considerable amount of work within that clinical area around patient flow, to ensure that our patients were not waiting in that area for long periods of time in an environment that was not fit for purpose. I'm pleased to say that in March of this year, HIW returned to undertake a further unannounced inspection to ensure that the improvement plan that we had put in place had been progressed. And I'm delighted to tell you that the recent report that's been issued from HIW demonstrates the fact that that has. There was one small area in relation to identity badges, bracelets, which we have now addressed. So coming back to the references that the Chair and Chief Exec have made in relation to COVID, throughout the COVID period, yes, our staff have been absolutely wonderful. They've gone the extra mile and undertaken and worked very long hours. But we have done all we can to try and ensure that we maintain quality and safety, not just for our patients, but also for our staff. So we spent a considerable amount of time in the quality, safety and patient experience agenda, trying to ensure that we provided the appropriate PPE in the right environments at the right time, to ensure that our infection prevention and control team have been there to support our colleagues and keep our patients safe. We have seen some cross-infection, which I will reference within our board report at our board meeting later today. But I'm pleased to say that we've managed that very quickly and very robustly, and we're now a long period of time without seeing any cross-infection from COVID within our hospital environments. And I would like to also thank our volunteers, predominantly student nurses and doctors, who've helped us with the visiting for those families who've not been able to see their loved ones during the COVID period. They've helped us very much with virtual visiting, or going that extra mile to make sure that the patients get what they required. And I'd like to also thank all those people who donated large quantities of food and drink to our staff, but also to clothing, pajamas and toiletries and so forth, which made our patients' stay during the COVID period a much brighter one. So that's just a short overview of the quality and safety and the AQS agenda. Thank you very much, Chair.
Thank you, Ruth, very much. And the safety of our patients is obviously paramount in everything we do. The quality of service that they experience whilst they're with us is vital as well. So this report is fundamental to the work of this health board. So thank you very much, Ruth, for that. Again, we've all had the opportunity to study it in detail prior to the meeting. Is the meeting happy to adopt the annual quality statement, please?
Yes.
Yeah. Thank you very much. Okay, we're moving on now to something which hopefully will be very pleasant. We have an aspiring Steven Spielberg in the organization. That's Carl, and he's hopefully ready to share with us our year in review. Carl, are you there and ready to go?
Yep, hopefully this will work now. I'll just get it going for you. Just bear with me.
Thank you, Carl.
name Dragon Heart Hospital, I think is a great name. It sets it in the Welsh context, but it actually says we are going to care for the people who need us, and we can do that, and that's the message I would send. We believe we can do this, and we can do this really well.
Okay, thank you, Carl. Obviously, Carl has shared with us there just a glimpse of some of the wonderful things that have happened across the health board, and in particular in the light of the COVID crisis. It's so pleasing to see so many staff actively engaged in working with our patients and seeing them through these terribly difficult times. So thank you, Carl. Okay, I haven't been made aware of any questions from the public as yet. Are there any questions, please? No? Okay, well, that's pleasing in one way and disappointing in another way, but there we are. Okay, well, this brings our AGM to a close for this year. As we've heard, the past 18 months have been incredibly busy and challenging, but it's enabled us to be better prepared for the winter months that are ahead of us, and sadly, a second wave of COVID-19. However, we all need to take personal responsibility, please, to keep our staff and patients safe as we move into the coming months. On behalf of the board, I want to thank you for joining us today and ask you all please to stay safe. Thank you all very much. Hwyl fawr now.